everyone, and welcome back to my channel. This is Dr. UDOCHI, and thank you for stopping by. I know it's been a long time, but here I am. So this first week of August is Breastfeeding Awareness Week, and I decided to make this video just to educate everyone about breastfeeding and how to breastfeed effectively. Breastfeeding is not just beneficial to the baby, but also to the mother and to the society, and hence it's very important for us to spread awareness about breastfeeding and make sure a lot more mothers are able to effectively breastfeed their baby. So there will be timestamps on this video, in case you want to jump to any part of the video, but I will advise you to watch everything about this video, because I'm pretty sure this is not just going to help you, but it's going to help someone close to you. And not just watch the video, but do well to share the video to someone. And without much further ado, let's get down to this video. So first and foremost, the breast milk is the best milk for every infant or every baby. And why is it so? Because it is very nutritious for the baby, it is sterile, it is more economical, it contains antibodies or anti-infective properties for the baby, and this makes the breast milk the best milk for any child. So we'll talk about the cardinal principles of breastfeeding. What are the principles that we should know about breastfeeding? The first principle is initiation, and you have to initiate breastfeeding as early as possible. For those that gave through that had a vaginal delivery, at least half an hour or maximum of 1 hour after delivery, and 4 hours after cesarean delivery. Secondly is exclusivity. What do I mean by exclusive breastfeeding? Breastfeeding should be exclusive for 6 months, for a period of 6 months. So for that first 6 months of the baby's life, you have to give only breast milk without any other thing, not even water. And the last thing about the cardinal principle of breastfeeding is continuation. Now, after the exclusive breastfeeding for a period of 6 months, you have to continue breastfeeding the child till up to about 2 years of age with other complementary feeding. Now, what are the benefits of breastfeeding? Breastfeeding is not just only beneficial to the baby and to the mother, but also to the family or the society. So first of all, we'll talk about the benefits of breastfeeding to the child. The breast milk contains all the nutritional requirements of a baby, and therefore it is specific to the child or to the baby. The breast milk is easily absorbed and easily digested. Breast milk also is said to have an increased brain development or brain growth in babies. Therefore, babies who are properly breastfed have a higher IQ than other babies. Breast milk also decreases the chances of infections in the first few weeks or months of life, such as diarrhea, pneumonia, ear infections, and so on. Breastfed children also have decreased incidence of hypertension, type 2 diabetes, and other chronic diseases later on in their life. And breastfeeding also helps a child or a baby to have nurture bond between a baby and the mother. And breastfeeding also decreases the incidence of dental caries. Now, what are the benefits of breastfeeding to the mother? Breastfeeding is beneficial to the mother as it helps to burn calories. Breastfeeding also decreases the chances of postpartum hemorrhage and also increases or assures early uterine involution. That means the uterus can go back from a pregnant state to a non-pregnant state after delivery. Breastfeeding decreases the incidence of breast and ovarian cancer in women, as well as osteoporosis, arthritis, type 2 diabetes, and even cardiovascular diseases. Breastfeeding also is convenient for the mother, as the breast is there, and it decreases the workload of the mother. Also, breastfeeding also nurtures the bond between a mother and her baby. Now, what are the benefits of breastfeeding to the family? Breastfeeding helps in family planning, as one of the hormones which are responsible for breastfeeding or breast secretion suppresses ovulation. Breast milk is very economical, and it's more environmental friendly. It doesn't cause any pollution, and also it increases the child survival rates in the first year of life. So now let's talk about the anatomy and physiology of the breast. Yes, we all know that the breast contains fat, but it also contains glands, and these glands are where the breast is being formed. And from these glands are lactiferous sinuses, where the breast milk can be stored briefly. And then from the lactiferous sinuses, there are lactiferous ducts, and these ducts open up to the nipple. Now we'll talk about the milk secretion and the milk ejection. And this involves an interaction between hormones and reflexes. Now, two hormones comes in mind when it comes to milk secretion and ejection, and these two hormones are prolactin and oxytocin. Prolactin is secreted by the anterior pituitary, while the oxytocin is secreted by the posterior pituitary. By the way, I have a question, and I want you to comment down below. There are two hormones secreted by the posterior pituitary. If you know the second hormone, oxytocin, and which other hormone, comment down below if you know the answer to this question. So let's get back to the video. So what encourages prolactin to be secreted? Prolactin is secreted when a baby suckles or during night feeds, because this hormone is mostly secreted at night. So when the mother feeds the baby at night, the prolactin is bound to be produced much more in quantity. And prolactin is also secreted if there is a good attachment, if the baby attaches or latches, on the nipple properly, and if the milk is expressed properly from the breast. And factors that inhibits the secretion of this prolactin is poor attachment or poor latchment of the baby, if the baby is not being fed properly, and if other feeds are introduced before breast milk, which is called prelactal feed. The oxytocin is secreted, is much more emotional. So things like the baby's cry, the baby's voice or noise can stimulate the secretion of oxytocin. And things that can contribute to the secretion is suckling of the baby, which is very, very important for even both the prolactin secretion, and things that can decrease its secretion is when the mother is stressed, worry, anxiety, or doubt, or if she doesn't have confidence in breastfeeding. So these are the two hormones that are involved in secretion and injection of milk. Now let's talk about the types of breast milk. There are many types of breast milk. The first type is the colostrum. The colostrum is the breast milk that is secreted few hours or few days after delivery. This milk is usually yellow in color. It is very thick, and this milk has high concentration of antibodies in it and proteins. So this milk is very, very crucial for the baby to have the colostrum, because these antibodies contained in this breast milk will help the baby fight against infections. Now the second type of milk is the transitional milk. The transitional milk is secreted from the second week after delivery, and this milk the protein concentration has decreased, and there's a fat and sugar concentration increases in the transitional milk. And the next type of milk is the mature milk. The mature milk is the milk that is secreted from the third week of after delivery, and this milk contains all the nutritional requirements that a baby needs. This milk tends to be a little bit more watery compared to the colostrum and the transitional milk. And the next type of milk is the preterm milk. The preterm milk is the milk that, secreted by the preterm mothers that delivered before the expected time or the due time. And this milk contains more sodium, it contains more iron for the preterm baby that the baby needs in that phase of the baby's life. The next type of milk is the FORE milk. This FORE milk is the first milk that is being secreted during breastfeeding, and this breast milk is very watery. It has protein, higher level of protein in it, and it satisfies the taste of the baby. And then the next type of milk is the HIND milk. This milk contains more of fat, and it boosts the child's energy. It contains more energy in it, and it is very important that during breastfeeding both the FORE and the HIND milk is given to the baby. So how do we make sure of this? Please do not start breastfeeding a baby in one breast and just move to the next breast. Please make sure you expel all the breast milk in one breast before making sure that both the fore and the hind milk is there in the breast milk before you move over to the next breast. So now let's talk about how to effectively breastfeed a child or a baby. Now this is going to be a little bit tricky in explanation, but I want you to pay keen attention to how I'm going to explain this, because this can actually help a mother to breastfeed her baby effectively. So the first thing we talk about how to breastfeed is the position. Now there are different types of position that a mother can use to breastfeed the child, whether be lying down or sitting down. It depends on the mother, and the mother has to try these different positions to make sure she finds one that is suitable for the baby to latch properly or to attach properly to her nipple to suck effectively. How do we know that the baby is positioned well? The baby is positioned well when the head of the baby is being supported, and when the head and the body of the baby is in line, and the baby's abdomen touches the mother abdomen. The baby is also turned towards the mother to take the breast milk from the mother. The breast is supported by your fingers below the breast and then your thumb above the areolae, helping to shape the breast and express the breast milk. And how can you make sure that the baby attaches to the nipple? You express a little of the milk up until to the nipple, and then you allow the baby's mouth to touch the expressed milk on the nipple. So this will enable the baby to latch or to attach its mouth properly on the nipple. Now we'll talk about how do we know that the baby's mouth is well attached to the nipple to make sure the baby is suckling properly, because most times a lot of women have an issue of the baby not attaching properly, and because of that there is ineffective suckling by the baby. How to know that your baby is attached properly or the baby's mouth is attached properly to the nipple is that you will see more of the areola above than below the baby's mouth. You will see that the baby's mouth is wide open, and you will see that the lower lip of the baby is outward, and also you will see that the chin of the baby is touching the breast. Now the paw attachment is very, very important, because if it is not done properly, there are complications, not just to the baby of not getting enough breast milk, but also to the nipple as well. Now if your baby is not able to suckle or attach properly to suckle, then you can use a spoon to feed the baby the breast milk. Please do not introduce bottle feeding at the early stage. What are the signs that you see that will make you know that a baby needs to be breastfed? So the baby's eyes can open, the baby can open his or her eyes, the mouth can be wide open, there can be saliva drips, and the baby is licking the saliva. The baby can reach out for the breast, and the baby's tongue can be forward. So these are some of the signs that you will see, and it will make you dictate that, oh, this baby needs to be breastfed. And a lot of people ask, how often should we breastfeed? How many times should we breastfeed in a day? And the answer is you breastfeed on demand. So this means that whenever a baby needs to be breastfed or needs breast milk, you breastfeed. Typically we say you should breastfeed around 8 to 12 times in 24 hours, and there should be 2 to 3 hours between each breastfeeding. Also, we should know that the night feeding is very important, as this helps in the release of the prolactin that we talked about. So in as much as you breastfeed the baby a lot more often during the daytime, also do inculcate night feeding. So how can we assess that a baby is adequately breastfed? So first, the breast should be soft after breastfeeding. So that means that the breast milk has been properly expressed out. Secondly, the baby sleeps well in between breastfeeds. So in between the time that you breastfeed the baby, you see that the baby sleeps adequately, and the baby passes urine 6 to 8 times in a day. Also, the baby gains adequate weight. So with all this, we know that oh, you're on the right track and you're breastfeeding your baby properly. A thing to note, there should be extra nutrition for mothers who are breastfeeding. So there should, in the first 6 months, whereby you have, you're constantly breastfeeding your child, and exclusive breastfeeding that we talked about, you need at least 600 calories much more in your diet, than in your non-pregnant state. And then afterwards, you need about 500 calories more in your diet. So now let's discuss about the challenges of breastfeeding, or issues that can be faced during breastfeeding. The first and important issue or challenge is not enough breast milk, and this is caused by when the mother is inexperienced as a new mother, when there is a poor attachment of the baby, or if breastfeeding is not done frequently as possible. And the treatment is just for breastfeeding to be done much more frequently, to ensure that the baby is properly attached and is suckling effectively, and also to increase fluid intake in the mother. And we can also give massages to relieve any anxiety or tension. Back massages are very, very effective, and a husband or anyone can give it to the new mother, and this will help the mother to relax more and be able to breastfeed more. If this persists, then you can call your doctor. Other challenges of breastfeeding are inverted nipples, sore nipple, breast abscess or breast engorgements, and all that. There are different mechanisms of way we can handle and treat that. Make sure you call your doctor in case you're experiencing any difficulty or any challenges in breastfeeding. Now, for the last part of this video, I want to talk about contraindications of breastfeeding. Where are those situations that we say no, don't breastfeed the baby? We advise women who are taking anti-cancer or radioactive medications not to breastfeed. You have babies with inborn errors of metabolism. In women who take alcohol, usually we don't advise women to take alcohol during breastfeeding, but if you must take in low quantity, and breastfeed a baby 2 to 3 hours after the alcohol consumption. And also women who take high caffeine intake in their diets, and also maternal infections such as HIV, we advise not to breastfeed at those points. But if you must breastfeed, you have to discuss with your doctor, who will be in a better position to tell you if or not to breastfeed. But in other conditions, please advise you to breastfeed your child. So with that, thank you so much for watching this video, and if you have any questions, please leave them down in the comments below. Please make sure you thumbs up my video, leave a comment for me. If you want me to make more of these videos, please let me know. I am willing to make them, and it's good to be back on YouTube, and I'll try my best to be much more consistent from henceforth. And please subscribe, give a thumbs up, do all those good stuff for my channel, and please share this video to your loved ones. Don't just watch it alone, because I'm pretty sure this video is going to help a lot of people who don't know a lot about breastfeeding. People will be much more educated about breastfeeding, and children can be breastfed much more effectively. So thank you so much for watching, and see you in my next one. Bye.